So to start from where you left and to supplement what you said and also to answer your question, firstly, healthcare is certainly the most regulated sector. So there's a plethora of laws which medical personnel feel at loss navigating through the minefield of laws and trying to meet the obligations of the law. And unfortunately, they are not even aware of some of the statutes or provisions of the law. So point is that certainly healthcare sector is over-regulated. So on one side, there's a plethora of laws, and on the second side, some of them are quite archaic laws, like the Indian Epidemic Act is of 1880 vintage. So some of the acts also need to be upgraded or they need amendment. And on the other side, there could be too many laws, but as Dr. Joshi has brought out, that to maintain oversight, we need to have some laws. But what is more important is the enforcement and interpretation. So by these two things, interpretation and enforcement, I would clarify further. Let's take PCP-NDT Act, which is the bane of most of the healthcare professionals. For uninitiated, PCP-NDT Act is the Prenatal Conception and Diagnostic Techniques Act, like the Act against female feticide. Now it's purely a socio-cultural problem, but the legal authorities have come very high-handedly on medicos. That not only violation of law, which certainly we all feel should be a serious offense, which should be punishable to root out this evil from the society, but for the procedural lapse, say inability to fill up a form or to provide certain report, also the machines are confiscated or the clinics are closed, or due to unintentional lapses also the doctors have to bear a heavy price. So similarly, look at the Biomedical Waste Management Act. So good, it's for environmental protection, but the point is that these laws should be practical also. Wherever they are implemented, government is not able to provide the incinerators with right specifications. If government says that waste has to be carried in AC van, that may not be feasible. To collecting waste in polyvinyl chloride-free bags, that may be another problem. So when we are implementing laws, we should see that there is a right kind of feasibility, people are able to follow them, and they are followed in letter and spirit, and they don't come as a draconian laws. So this enforcement and interpretation is also important. Second thing is the need for an overarching health regulatory authority. Now, to emphasize this point, clarify this point, as the panelists have brought out, say healthcare is under Ministry of Family Welfare and Health. The drugs are under Ministry of Chemicals and Fertilizers. The pricing of drug is governed by National Pricing Authority. And the issue of generic and branded medicine is also addressed by DCGI. Medical devices are under DCGI, though there's a proposal to create another authority called Device Management Regulatory Authority. So with so many agencies to deal with, it becomes very difficult for healthcare professionals to walk the talk or to walk the minefield of so many laws. So certainly there is a need for single window clearance. When a healthcare organization has to be set up, establishment has to be set up, there should be single window clearance, and there should be single overarching agency which supervises or monitors all the aspects of healthcare. So there's no dichotomy, there's no bureaucracy or red tapeism. And another issue is that certain laws which may be needed or which were flawed and couldn't see the light of day, or they have not been accepted widely because of the protests by the Indian Medical Association and so on, like Clinical Establishment Act or National Healthcare Bill, National Council for Human Resource in Healthcare. So all these laws, the government has no time to look at these because it is being in other affairs. But certain laws may be needed now with the changing times, like something akin to HIPAA may be needed, where the sensitive and confidential data of the patient is protected. As of now, we are not aware that if the data is lost or there's a cyber theft or thing like that, what are the remedial measures? Is there any need to notify loss of patient-sensitive data? And similarly, something on the line of Patient Safety Act. But point is that more important than plethora of laws is the proper enforcement and the proper interpretation. So that is my take, sir. And there is certainly a need for a single regulatory authority that can oversee all these legal statutes.